So this week during our sessions, you're going to be learning about several different immunological diseases and other different types of organ failure conditions. But one particular that you're going to be studying this week is fibromyalgia. It's one that over the last 10 or 15 years has garnered a lot more attention in the medical community as well as the exercise physiological community. For years, people thought it was kind of a myth. Doctors kind of passed it along as it was more of a mental issue than an actual condition. There was a lot of unknowns around it, but as research has advanced, as more clinical studies have progressed, they've come to discover more about fibromyalgia, that it is a true physical condition. And in some cases, usually the overall consensus is a type of autoimmune disorder in a way. It can be exacerbated by mental health conditions, but for the most part, it's kind of an attack on the nerves. And so, as you encounter more and more population that suffer from this ailment, how can exercise assist? Because in many fibromyalgia patients, they avoid exercise because of their joints hurting, they're stiff, and they often say more exercise makes it worse, exacerbates the problem, when in fact, exercise can help alleviate many of the issues. But you have to be careful and selective about what type of exercise and also when. And so, how do we address someone who has fibromyalgia? How do we truly help them? Well, there's a lot of research that shows that resistance training can help improve joint mobility, reduce inflammation, and stiff muscles. That's one. Aerobic activity is one as well. But then really, there's more research pointing to a mixed methods approach that incorporates, yes, aerobic training and resistance training, but more heavily focused on flexibility, gentle movements, as well as swimming and dance. So kind of a mixed methods approach that helps both strengthen a person, but also increase flexibility, mobility, and functional movement. Many people with fibromyalgia try not to move, so their functional ability decreases. So we want to do all of the above. But we found that dance, yoga, swimming, low impact, aerobic, but as well as strengthening activities are really beneficial. Yoga especially, Tai Chi, because it not only focuses on the physical, but it helps relieve stress. So consider those things as you study and learn about fibromyalgia.